We will talk about the effectiveness of regenerative therapy as a new hope for dementia treatment. According to an announcement by the Ministry of Health, Labor and Welfare, it is estimated that 1 in 5 elderly people will develop dementia by 2025. As shown in the pie chart on the right, 2/3 of dementia cases in the elderly are caused by Alzheimer's disease, so today I would like to talk about the results of treatment for Alzheimer's disease. In insurance-covered medical treatment for Alzheimer's disease in Japan, doctors prescribe drugs such as donepezil, galantamine, and rivastigmine as acetylcholinesterase inhibitors, but their action is said to be to activate remaining nerve cells and temporarily alleviate symptoms. Memantine, an NMDA receptor inhibitor, also temporarily alleviates symptoms, but it is said that it cannot reverse the symptoms. A recently released drug is lecanemab, a monoclonal antibody against amyloid beta. This medicine has the effect of removing amyloid beta, a protein that causes the disease, and slowing the worsening of symptoms. Although these drugs can slow the progression of dementia, they are said to be difficult to stop or reverse the progression. Therefore, we have started regenerative therapy using adipose-derived stem cells, ADSC, to treat Alzheimer's disease. This shows the changes in dementia symptoms when ADSC was administered 3 to 6 times to 14 people with Alzheimer's dementia. The vertical axis, MoCA, is a scale of cognitive function. The higher the value, the better the cognitive function, and those over 26 are said to be healthy adults. The patient shown in red has a cognitive scale score of 5 or less before administration, and the patient's symptoms are quite bad, but even in such patients, the symptoms gradually recover, and the cognitive scale score recovers to 8 to 10 after 6 doses. However, no one was seen to improve to normal levels. On the other hand, of the 12 patients whose MoCA scale was 9 or higher before starting the treatment, shown by the blue and black lines, data showed that 9 patients were close to normal or exceeded the normal value at treatment end. This means that 75% of patients saw improvement in their symptoms. We will show you PET images showing changes in amyloid beta in the brain before and after treatment, which is said to be the cause of Alzheimer's dementia. Case 1 is an 82-year-old man. Amyloid beta is often seen in the red part of brain images. The red dots in the yellow area are reduced after treatment compared to before treatment, indicating that amyloid beta in the brain is decreasing. Case 2 is an 83-year-old man. Before treatment, the figure on the right in the upper row shows that amyloid beta has accumulated, but after the 6th treatment, the red dots have decreased as shown in the lower row, indicating that amyloid beta in the brain has decreased. Case 3 is a 70-year-old woman. There appears to be little difference before and after treatment or a slight increase after treatment. In this way, amyloid beta does not decrease in all cases, but in some patients it remains the same or increases slightly. This seems to vary depending on conditions such as the timing of this PET measurement. Case 4 is a 77-year-old woman. Look at the top right corner. After treatment, the red dot on the right side of the bottom row has decreased considerably. Thus, adipose-derived stem cell (ADSC) treatment reduced amyloid beta accumulation in 3/4, 75%, of patients. Amyloid beta did not decrease in all cases, but in 75% of patients. Now, I would like to show you the changes in tau protein, another disease-causing substance, before and after treatment. Case 1 is an 88-year-old man. The upper row is before treatment, and the lower row is after treatment. I think it's easy to understand if you look at the image on the right side of the top row. The red part is tau protein, and after treatment, tau protein decreases. Case 2 is a 77-year-old woman. The upper row is before treatment, and the lower row is after treatment. Looking at the red area, it is clear that the amount of tau protein accumulated in the brain has decreased after treatment. We will explain specific changes in symptoms before and after treatment. Here we briefly show the changes in symptoms of 5 Alzheimer's disease patients before and after treatment. Patient A was unable to return home alone from outside, especially shopping, but after treatment, he was able to return home alone from outside. His wife is also happy because she can now let her husband go shopping by himself with peace of mind. Patient B is a 77-year-old woman. She was unable to speak and was often speechless, but after the treatment her expression became much brighter and she became asking us to dance after the treatment. Patient C is an 80-year-old man. Although he was acquainted with his attending physician, he received treatment without realizing it. However, after the third infusion, he called out the attending physician's name and asked for a handshake. Patient D is an 83-year-old man. He is a director of a university, and every time he had a visitor, he asked the secretary, "Who is this person?" and checked the name with a business card, but after the third infusion, he was able to say the name of the visitor, "Welcome, Mr. XXX." Patient E is an 82-year-old man and a truck driver. Once, he was found by the police crouching in the woods in the wrong direction after getting lost. After the 6th treatment, he was able to go to the fields by himself and come back home. Now, I will explain specifically how this adipose-derived stem cell treatment proceeds. Abdominal fat cells are collected under local anesthesia, and stem cells are isolated and cultured. The culture period takes 6 to 8 weeks. The cultured stem cells are injected into the patient once a month, for a total of 3 to 6 times. In this slide, adipose-derived stem cells can differentiate into nerve cells, muscle cells, circulatory system cells, vascular cells, bone, cartilage, and adipose tissue as shown on the left. They have the ability to differentiate into various types of cells. They have pluripotency. We understand that adipose-derived stem cell (ADSC) therapy is possible because of this multipotency. Stem cells have 2 characteristics. One is migratory. It has the property of moving to abnormal areas of the patient. The second is accumulation. They gather in abnormal areas of the patient. Because of these very useful features, ADSC treatment can cure what is wrong with the patient. This is an adipose-derived stem cell, ADSC, seen under a microscope. ADSC treatment also treats other incurable neurological diseases. Showing results of Parkinson's disease treatment. The bar graph shown in blue at the top is an example of improvement. 8 of 9 patients, 89%, improved. There was no improvement in 1 out of 9 cases, 11%. In this way, symptoms of intractable neurological diseases other than dementia were improved by approximately 90%. This is the result of ADSC treatment for the incurable disease amyotrophic lateral sclerosis, ALS. The vertical axis shows an evaluation index called ALS-FRSR. The higher the value, the better the symptoms. The horizontal axis is the number of administrations. As summarized in the lower right corner, 13 patients with ALS underwent ADSC treatment, and symptoms improved in 7 patients, 54%, shown by the red line. 3 cases, 23%, shown in blue showed no significant change, and 3 cases, 23%, shown in black showed worsening of symptoms. Most patients with ALS die within 5 to 7 years after onset. Neurologists say that the fact that symptoms improve in half of ALS patients is miraculous. Here are some specific examples of symptom improvement. He is a 53-year-old man. Before treatment, when he ate, he would aspirate and cough, making it difficult to speak, and even when he spoke, saliva would get into my lungs. When he tried to squat down, he fall backwards. He had motor impairments, such as difficulty walking by herself. However, after the 3rd treatment, he no longer coughed when he ate, no longer fell backwards when he squatted, and was able to walk by himself using a cane. The attending physician determined that his symptoms would not get any worse. Even now, 12 years after his first treatment, he still drives his own car and works. This is the most effective example, and it clearly shows the effectiveness of ADSC treatment. We summarized research results on the mechanism of ADSC treatment for Alzheimer's dementia, amyotrophic lateral sclerosis, ALS, and Parkinson's disease. Amyloid beta, which is the cause of Alzheimer's disease, accumulates in the hippocampal region. We found that ADSCs secrete neprilysin, an enzyme that degrades amyloid beta. This discovery was published in an English paper in February 2024. Tau protein, another cause of Alzheimer's disease, phosphorylates and accumulates in brain nerve cells. We found that ADSCs secrete an enzyme called relin that inhibits the phosphorylation of tau protein, and published our findings in the English journal Medical Hypothesis in December 2023. Regarding ALS, the causative agent of ALS is a protein called TDP-43, which accumulates in the spine and causes the symptoms of ALS. It was discovered that an enzyme called caspase-4, which degrades TDP-43, is secreted from ADSC cells, and was published in Medical Hypothesis in 2023. Regarding Parkinson's disease, we were the first in the world to discover that G3BP1, an enzyme that degrades alpha-synuclein, the causative agent of the disease, is present in ADSC cells. The paper is currently being submitted to a journal. In this way, we believe that one of mechanisms for improving intractable neurological diseases is that ADSC cells secrete enzymes that degrade disease-causing proteins. Next, I will explain the safety of ADSC treatment. We have treated 91 people, including Alzheimer's disease, Parkinson's disease, ALS disease, and COPD, a disease that we haven't talked about today, but where the lungs deteriorate and require an oxygen mask. A total of 602 doses were administered, but there was only one adverse event, hematoma, 1.2%, after surgery. I don't think safety is an issue. Above, I have talked mainly about dementia as it is the dawn of treatment for incurable diseases. Thank you very much.
Thank you, Professor Yamagishi. He talked about ADSC treatment, which not only slows the progression of dementia but also brings about major changes in people's lives. Isn't this the treatment that many people want? I think everyone is interested in the treatment, so I would like to set up a time to ask Dr. Yamagishi questions. I will read out the questions we have already gotten. First question. New drugs for dementia have been introduced in Japan, and I believe that new drugs will continue to appear one after another. Please let us know the compatibility, synergy, or role sharing between regenerative therapy and these new drugs.
Regarding drugs for dementia, we are instructing patients to continue medications prescribed by attending physician during ADSC regenerative therapy. Due to the small number of cases, we have not yet determined which drugs are compatible with ADSC therapy, but we explain to patients that regenerative therapy will be performed in parallel with previous treatment.
Thank you. I believe that some patients with dementia have other diseases, but is it correct to assume that there are no problems with the compatibility between previous medication and ADSC therapy?
Yes. Even in ADSC treatment for diseases other than the ones I talked about today, we are instructing patients to continue previous medication.
Thank you. I had the impression that it was a treatment that I could receive with peace of mind. Second question. Please tell us about global trends in regenerative therapy for dementia.
ADSC treatment is not available everywhere. Doctors at most universities and general hospitals in Japan do not know that regenerative therapy can improve dementia. I hear that a clinical trial with a large number of subjects is currently being conducted at Harvard University in the United States, but I don't think the results have been announced yet. I think this treatment is progressing in Japan and America.
Thank you. I imagine it takes a lot of time and money to conduct a clinical trial, but is this the reason why ADSC treatment has not progressed yet in Japan?
I agree. During clinical trials, we do not collect treatment fees from patients. However, culturing the ADSC cells used in this treatment is expensive. Currently, a single infusion of ADSC cells costs approximately 4 million yen, and is performed about 6 times. Since it is difficult for doctors to pay for these costs, we currently ask patients to pay for them in the form of free treatment.
Thank you. I'm also curious about the results of the Harvard University trial. I'm looking forward to it. I would like to pay attention to the results. Next is the third question. When I visited Najituji Hospital in Kyoto, which provides ADSC treatment, they recommended 2 courses of 3 doses per course. Will ADSC cells decrease significantly in the body between administration intervals? Also, some patients have been given treatment up to 18 times.
It is a basic but very difficult question. The half-life, time for the number of stem cells to decrease by half, of the administered stem cells is not yet known. However, lymphocytes, which are closely related to ADSC cells, are said to have a half-life of 2 to 3 weeks. Therefore, we decided to administer ADSC cells once every 1 to 2 months.
Thank you. Next is the fourth question. Is it possible that ADSC treatment can improve memory impairment, which is a typical symptom of dementia? Also, are there any medical institutions around Tokyo that can receive ADSC treatment? If so, please let me know the name of the medical institution and the cost.
As explained earlier, if dementia is not very advanced, MoCA equals 9, 10, 75% of cases will improve to near normal. Memory problems are also improved. I don't know if there are any medical institutions that provide similar dementia treatment around Tokyo. We were the first in Japan to start dementia treatment using stem cells in Kyoto. There are probably medical institutions around Tokyo that provide similar treatment, but we are not affiliated with them, so we do not know the details. At Najituji Hospital in Kyoto, ADSC treatment is performed once every month for approximately 6 months. The treatment cost is approximately 4 million yen per dose.
Thank you. This is the fifth question. Dementia treatment using ADSC would be Nobel Prize-worthy research if it could be put into practical use. But why is it so poorly recognized by the public?
As I mentioned earlier, even among university doctors, it is not known that dementia can be cured. We are currently publishing approximately 14 overseas papers. In addition to publishing papers, we are publishing a Japanese book, Don't Give Up, which describes the therapeutic effects and mechanisms of ADSC treatment. We are trying our best to help everyone understand what we have done.
Thank you very much.